Hello, my name is Vishva, and I'm here today with Brianna, Gisela, and Krista to promote a prevention method for typhoid fever. Before we get started, we would like to kindly ask to save your questions until the end of the presentation. Next slide, please. As you can see, we will cover a lot today, from what typhoid fever is to a potential action plan in order to prevent future typhoid fever outbreaks in Bauchi, Nigeria. Next. But before we get started, we would like you guys to imagine that you're a farmer living and working in Bauchi, Nigeria. After a long day, you come home to an unwell son. Your son has a body temperature of 39 degrees Celsius and a constant abdominal pain. Your son complains that his stomach started hurting after a week ago when he ate food from a new restaurant. After listening to the story, you knew exactly what was causing him so much pain: typhoid fever. Now, ladies and gentlemen, drinking contaminated water and eating contaminated food is one of the fastest ways of contracting typhoid fever in nations where the illness is prevalent. Our goal here today is to provide a context of typhoid fever and propose a solution that could help lower typhoid cases by educating the people of Nigeria about accessible prevention techniques. Next. What is typhoid fever? Typhoid fever, also known as enteric fever, is a multisystemic illness caused by the bacterium Salmonella typhi. According to the WHO and the CDC, about 21 million people are infected by the bacteria every year. Of those that are infected, about 200,000 people die from complications that arise from contracting the illness. Some symptoms of the disease include a stepladder like fever and GI tract problems like constipation or diarrhea. Some complications of typhoid fever include intestinal bleeding, intestinal perforation, and of course, death. According to the CDC, about 30% of individuals who do not receive a treatment eventually die from the complications of typhoid fever.
Treatment of typhoid fever is extremely limited. The only option to treat it is via antibiotics such as ciprofloxacin. However, most strains of typhoid fever have gained a multi-drug resistance to many antibiotics. A globally present strain has exhibited elements of resistance to antibiotics that are currently being used to treat typhoid. Additionally, the average price of antibiotics used to treat typhoid fever is anywhere from $7 to $15 US. Nigeria is a low to middle income country, and many of its inhabitants live on under $1 a day, making it nearly impossible for them to afford the antibiotics necessary. That, along with the danger of the disease itself, is why it is so important for our team to target prevention rather than treatment of typhoid.
Typhoid fever in Nigeria. In Nigeria, the peak season for typhoid fever is from July through September. With a population of 190 million people, about 3.67% of the money provided by the Nigerian government is allocated to the Nigerian healthcare system. Another key thing I want to point out is the accessibility or lack of to sanitation services. According to the Nigerian WHO website, about 42.72% of the Nigerian population uses at least basic sanitation services. Of those 43%, about 31% uses safely managed sanitation services. Bauchi is a state located in the northern part of Nigeria. It is extremely diverse with over 55 tribal groups residing in the area that speak more than 50 different languages. There has also been a large population boom in the last years due to civil unrest in the neighboring states such as Borno and Yobe. The increase in population increases the population density of Bauchi. About 132 people reside per square kilometer of Bauchi state. The overcrowding of individuals in small areas can potentially cause typhoid fever outbreaks, and it is important to do something in order to prevent that from happening.
Children, especially those between ages 0 and 14, are at the highest risk of contracting typhoid fever. They have weaker immune systems and often play outside, where they may come into contact with things that are contaminated. Males also get typhoid more often than females because they are typically less careful when considering food hygiene. Additionally, married males have less cases of typhoid than single males. High populations of individuals tend to correlate to higher amounts of typhoid cases, as Vishwa said. Regions without proper sanitation or sufficient clean water have high amounts of cases. Next slide, please. Individuals can contract typhoid fever through contaminated food and water that contains the bacteria Salmonella typhi. Eating raw fruits and vegetables can also put you at risk for contracting this disease. A person can get sick by making contact with someone who has typhoid or someone who carries the bacteria, and they become sick when they ingest the bacteria. Climate also plays a role as typhoid spreads more frequently during the rainy season. Being close to open sewers, contaminated water, and living at a low elevation can also put individuals at risk for typhoid. Next slide.
Prevention. There are several methods of preventing typhoid fever, including vaccines, good hygiene, and boiling water. Vaccines are the least effective as they only work well for tourists, and even then, they are only 55% effective and wear off quickly. As mentioned earlier, typhoid fever is most commonly contracted via consumption of contaminated water. Therefore, it is important to ensure any water used is thoroughly purified. In most cases, communities' most accessible water is unfiltered tap water. An effective way of purifying this type of water is by bringing it to a roaring boil to detoxify it. Finally, good hygiene is crucial. Salmonella typhi can be transmitted through ingesting contaminated particles of feces. This occurs when someone already harboring the bacteria doesn't thoroughly wash their hands after defecation and proceeds to cook, allowing others to ingest it and contract the illness as well. Considerations. When crafting our proposal, there are several bioethical and cultural considerations to keep in mind. To begin, I'm going to talk about the cultural considerations. Foremost, we are aware of a language barrier between us and our target audience. Bauchi is home to over 50 distinct languages. For this reason, we aim to keep our language simple and reach out to our connections in Bauchi State for translations. Secondly, we are cognizant of the reliance of indigenous medicine in Nigerian communities. Many perceive diseases to be a consequence of disharmony between the individual affected and their environment, and is treated through prayer, herbs, plants, and massages. We realize that this is due to tradition and the high cost of Western medicine. With this in mind, we attempted to make our campaign as accessible as possible. We are also planning to encourage the public to be open to us and to change. However, we are not going to force them to. Next, Vishwa is going to be discussing the bioethical considerations.
When organizing the campaign, the biggest consideration related to bioethics was the right to individual freedom and the principle of autonomy, which is the right for an individual to make their own decisions. We will respect those who choose not to participate in our public health campaign. Another key thing we need to consider is the unethical use of fear-mongering and stigmatizing those who perform unhealthy practices. These techniques are commonly seen in obesity campaigns. They may look like good techniques, but in the end of the day, these practices do more harm rather than good.
Our proposed solution is Sorry, my apologies.
So there are several current strategies. In 2017, the World Health Organization pre-qualified a vaccine for typhoid fever. It has long-lasting immunity and requires less doses than older vaccines. It can also be given to those aged 6 months or older. It is prioritized in countries with the highest burden of typhoid in order to reduce the need for antibiotic treatment that might result in resistance. The Strategic Advisory Group of Experts, who advise the WHO, recommends the typhoid vaccines for routine use in typhoid endemic countries. After this recommendation, the Gavi board approved $85 million to fund typhoid vaccines starting in 2019. Additionally, when there are typhoid outbreaks, public health initiatives seek to increase accessibility to products that chlorinate water, teach individuals about water treatment, and provide clean water sources. Next.
And so our proposed solution is education. Education on proper hygiene and sanitation methods will go a long way towards eradicating typhoid in the Bauchi area. We aren't saying that these communities don't already know these methods, but we want to emphasize through education that knowing and learning these preventative measures is great, and consistently putting them into practice is even better. Initially, our solution was vaccines, but we pivoted away from that idea because typhoid vaccines are only 55% effective. Also, in Nigeria, many people rely on cultural practices of indigenous medicine, especially with the high cost of Western medicine, such as vaccines. So we came to the conclusion that education would be the most ethical solution. Providing education is a way we can support the people in Bauchi with what they need to protect themselves. So we plan to implement this solution through educational brochures on typhoid and its preventative measures, and as well as workshops. And then we plan to collect feedback and data for evaluation on our impact with our campaign. Next slide, please.
As you can see, this is a sample part of the brochure that we want to distribute for our public health campaign. This is the outside part, which lists the contact information as well as who we are. Next slide, please. This is the more important part of the sample brochure, as it shows what we will be doing in the education workshops, like what aspects of typhoid fever we'll be discussing in the education workshop, and some of the prevention methods we'll be focusing on in our public health campaign.
So the timeline of our campaign. As you can see, the first phase is our largest phase. We want to keep the energy for bringing about change by implementing right away. So in the first month, we plan to mass distribute brochures at clinics, schools, and community leaders we are partnered with. And then we plan to begin our educational workshops as soon as we recruit our partners. At the 3-month mark, we want to begin collecting feedback from the communities we are working with, just to make sure we are doing the right thing. This will happen every 3 months. At the 6-month and 2-year benchmark and onwards, we plan to continue monitoring the amount of typhoid cases. This will just help us to evaluate that we are making an impact and that and to see if the typhoid cases are decreasing or increasing. And so we can evaluate our campaign to align with that. Next slide, please. So the funding of our proposal. Most of our costs are going to phase 1, including the brochures, workshops, and hand wipes we will hand out at the end of those workshops. And that cost is 18,902 Naira. Phase 2 and phase 3 will be no cost. And so in total, our proposal would be about 18,902 Naira.
Key takeaways. Education on the significance of proper food, water sanitation, and proper hygiene is critical to working towards eradicating typhoid fever in Nigeria. We need to prioritize the culture, long-term health impacts, as well as the socioeconomic status in order to provide the best solutions.
Ethical considerations. Our team recognizes that we exhibit more privilege than the communities we strive to help. Our Western-based knowledge of public health and medical services hinders our ability to understand and solve the hardships impacting the communities we work with.
Using our ethical considerations to guide our campaign, our team's role is to advocate for better hygiene practices and provide prevention resources for the target population. Our goal is to provide adequate support in such a way that the autonomy of the target population is maintained.
Thank you for listening to our presentation. Here are questions now. Thank you.
Very good, thank you. I want to commend the team for their excellent work again. Just a lot of impressive things. First of all, the felt need you created by sharing the personal story of a person coming home, a farmer. That caught my attention, wanted me to pay attention because many of the people in Nigeria are going to be growing in their careers. Also, I thought some of the other strong points was your ability to go off of your initial solution, which is vaccine, and saying what would be more effective as you look at it. So I commend you for just not jumping at the easiest, but what would be the most effective way. And then I was really impressed with, this is not a one-shot deal. This is a timeline that over 2 years. So your interest is not just giving a workshop, moving on, but making sure from 1 month all the way to 2 years, we're effectively helping people understand how to prevent typhoid. So kudos to you, great job. And it was a pleasure listening to your presentation.
Thank you, Jim. Okay, Owl, we'd love to hear your thoughts.
Okay, really, that story you started, I connect with it very well because I live in the community. So this is like a typical story of an everyday father. You know, you either go to the farm or to work or somewhere, and the next thing you come back home or only to be called on phone and you be told that, okay, this is what is happening. Your son is having either typhoid or malaria. So that opening is really, really emotional, and I feel every person listening to this part will really be connected to your presentation. And one thing I really love about your team is you were able to own the presentation from the beginning to the end of it. You were so confident, and I love the way you presented the whole thing from step one to the end. And the way you break it down from the story to the causes to the treatment to prevention. And then one beautiful thing, the overview of the community, because really for one to really have any kind of a preventive measures that will be impactful, you must know the community you're dealing with, which that part I give it to you there as well. Now, you also consider the differences that exist between you guys and the community here, the barrier in language, and you try to explore and manage, or let me say, utilize the assets you have. That is us over here that will be able to do the work for you. You also considered the vulnerable groups. That is amazing. You know, you talk about who are most vulnerable and which of the period or the season it's more prominent for this infection. So by and large, you guys have done an amazing work, and I must repeat it again. I love the way you own the whole entire presentation, and that timeline is superb. It allows one to follow and track the success or what do you need to do again to fix this issue. So well done for that awesome work. Okay.
Perfect. Thank you, Owl, so much. Guys, you knew the science, but you also knew it's not enough to just know the science. You have to tell the story of the science to
Yeah.
get the community buy-in to sell the idea. If it was my team giving the presentation, I mean, if it was like my staff giving the presentation, I would think you were just a staff member. You were so good. You guys were on the ball. You hit your marks. You guys transitioned from one person to the next to the next. There was no like waiting or do I do this? There's no mumming. You know, you guys were ready. You were confident. But it was more than that. You cared about the community you were trying to give the information to. And sometimes when people give presentation, they do it from an American perspective. But you were doing it from not just a Nigerian perspective, but I would say a Bauchi Nigerian perspective. And that is a huge difference. You were making this for the community, for the people you wanted to help, and it showed through and through. Could not be proud of your presentation. You guys deserve a round of applause. Great work. Okay,